Hello and welcome. My name is Amy Vandenbroek. I'm the Executive Director of the National POLST Paradigm, and thank you all for joining us today. This is the third webinar in our series for the POLST Technology Consensus Conference. These webinars are intended to present background information for the conference attendees and cover what is currently being done with POLST integrating with state registries, electronic medical records, health information exchanges, patient access, and other items. I am delighted that Alan and Ryan are presenting today looking at the La Poste Health Information Exchange integration as an example. Alan Abshire is the Director of Health IT Operations for the Louisiana Healthcare Quality Forum. He oversees the daily operations of the Louisiana Health Information Exchange and other health IT initiatives. He is responsible for special projects, including upgrades, product lifecycle development, and support and collaboration with leadership and partners in the Quality Forum initiative to evaluate technologies that may have a positive impact on healthcare delivery in Louisiana. His experience includes more than 35 years in information technology, including more than 25 in the field of health IT. He has worked in various roles with regional health information exchanges, including Healthcare Access San Antonio, Greater Houston Health Connect, and the Louisiana Health Information Exchange. He currently serves on the Health IT Advisory Committee for the Louisiana Department of Health, the Board of Directors for the Louisiana chapter of HIE as a sponsorship co-chair, and the Patient-Centered Data Home Governance Council as a central regional representative. And then Dr. Ryan Van Wert is a prolific healthcare innovator and dynamic speaker with a passion for improving patient care through technology. He is a clinical assistant professor at Stanford University and the assistant director of the Faculty Fellows Program at the Stanford Bayer Center for Biodesign. His academic focus is in technology assessment and in teaching biomedical innovation. He is the co-founder and chief medical officer of Vynca, Inc., a Silicon Valley healthcare technology company whose mission is to improve care delivery at the end of life, and he is a co-founder of AWAR, Inc., a medical device company developing technology to reduce complications in the intensive care unit, which was licensed to Cook Medical Technologies in 2015. He serves as an advisor to young technology companies, including the Biomedical Zone, a hospital-based incubator in Toronto, Canada. So with that, thank you very much for joining us, and I will turn this over to Alan and Ryan.
Good afternoon and welcome, everyone. I thought I'd start out with a little bit of background about the Quality Forum, who we are, and a little bit about the little POST history. I think everybody on the phone is probably pretty much familiar with POST, and I don't want to go into a lot of detail about that. In 2005, or after the hurricanes of 2005, our governor, along with Secretary Leavitt and our Secretary of Health and Human Services here in Louisiana, should partner with a bunch of public and private hospitals, other healthcare providers, doctors, and established a Louisiana Healthcare Redesign Collaborative. This coalition and collaborative basically had a mission to develop, oversee, and implement a practical blueprint using evidence-based measures to do recovery and rebuilding of the healthcare system after those two hurricanes that devastated at least the southern part of the state. So once that happened, in 2007, the Quality Forum was actually formed, which was an outreach of that. We are a neutral convener, not-for-profit, volunteer board-driven organization to provide evidence-based collaborative initiatives to improve the health of Louisiana residents. In 2009, we were designated the state-designated entity for health IT grants from the ARA program. In 2010, we actually received a grant to become the Regional Extension Center and performed and created another entity called the HIE. We like the LA in front of everything, it seems, but our Louisiana Health Information Technology, which was to help providers implement electronic health records. And then in 2011, we were actually awarded the ONC grant to become the statewide entity to establish a statewide health information exchange. Besides the HIE, there's several other programs that we run throughout, and HIE is kind of bundled in our quality measures and analytics. We do have the health information technology. I mentioned that we still work with providers for continuing meaningful use and for MIPS MACRA. We do provide education and outreach. We have the patient-centered medical home here, and along with the POST. One of the things whenever we mention the term HIE to keep in mind is HIE is not, it's the health information exchange, but it's not an application. We think of HIE more as a platform for health information exchange that can include things such as the POST registry, other quality measures and analytics. We have a Louisiana IID Registry that we report ED visits to payers and other hospital entities throughout the state on a daily basis to help kind of monitor and provide care management and case management for those ED patients that are showing up. As to the POST actually got started in 2006 when it was established and endorsed by the Louisiana State Medical Society. Once that happened, and actually in 2010, to gain momentum during the session of legislature, they actually passed the POST philosophy, principles, and guidelines, as well as actually incorporate, and I believe we're the only state that's done this, the actual POST form that is done, that we have, is actually in the legislature. So the legislature actually included our form so that it couldn't be changed, which has created some challenges, but I think actually in the long term has actually made it easier for us to work on implementing it because we really don't have a lot of choice in changing the form. We have to use what's there or else, because we sure don't want to go back to the legislature to ask for changes of anything. In 2012, we received recognition and endorsed by the National POST Program, becoming the 14th state to have an endorsed program. Some of the things that we've done to help promote POST, which is an entire paper-based system we have today with no central repository for POST documents. The POST documents are maintained either by the individual or with the healthcare provider that completed the POST document for that patient, which in itself brings in a lot of challenges. What we did is we promoted some of the POST Ready campaigns and really pushed out in some major areas throughout the state. Baton Rouge, Covington, Lafayette, and the Monroe areas were our primary targets, which are basically, for those that aren't familiar, the South Central, a little bit of Southeast, and Central Louisiana. We've got a big push going now with Southwestern Louisiana to get that area going, and those POST campaigns basically consisted of webinars, site visits, attending medical society meetings, attending social work meetings, just anything we could get in front of anybody to get out there. Whenever we started this, as you can see, we had funding from a variety of sources, not just healthcare related, but a lot of entities that had an interest in healthcare outcomes and end-of-life care throughout Louisiana, including Retirement Research Foundation, a Pennington Foundation that we have here in the Baton Rouge area that does a lot of support and funding of different initiatives that throughout the state. Part of the rollout we did is we established our website, and our website basically worked with the Catholic Church. There's a great video out there from the bishop for anybody that's interested in looking for the Catholic that you may have in your areas. But it's a total educational website. It's got resources, FAQs, handbooks, marketing materials, like I said, handbooks for the providers, information for patients to go out and look at, FAQs that are designed, whether it's for the provider or the patient, that are really focused that way, videos and how-tos to do it, as well as the ability and instructions for downloading and completing the form, the paper-based form that we have today. We're in the process of revamping this website with going with an electronic registry as we move forward. As any of you may know, the challenges, and especially without having a central repository for the documents, there's lots of problems. Whether the patient didn't bring the form with them, they're at a different facility where the form was created. They don't remember what was on the form. Trying to get a hold of the location or the family member that may have the form for them. Being sure you've got the most current version of the form, and all those that are associated with paper-based forms. So we established an RFP. We sent it out to 5 different POLST vendors and received back responses from 3. After evaluation demos and back and forth with all the vendors, Vynca was selected as our post partner to be able to extend the HIE platform to include our POLST electronic registry. Currently today, we're in the early implementation stages of our POLST registry. The plan is to start out with a web-based access to that and roll into an integration with our health information exchange, and then an integration with our EHR throughout the state, and work with different healthcare systems to be able to actually integrate the POLST registry within the state, so that a provider does not have to leave their electronic registry to be able to have access to the POLST document and is aware of the patient's wishes. One of the most challenging things I think about integrating with the HIE is establishing who the patient is across multiple entities. We have about 2 million patients currently in our HIE system. And of those, I don't have the exact percentage at this point, but there's it's in a double-digit percentage of those that have visits from multiple entities that we have to be able to match up in HIE itself, so that we can consolidate the records to show a one master patient view and the longitudinal medical record. We're utilizing that master patient ID that we have in that to do the same thing with Vynca, so that when a patient shows up at healthcare facility B, but they get their POLST document at the nursing home where and there's an ED transfer, that ED clinician can be able to match that patient according to their medical record number in the ED with whatever patient ID may be coming from that nursing home. So it does present a challenge, but it's a very workable challenge. There's a lot of things to take into consideration when you're doing that, especially if you start thinking about areas that might not have a full-blown EHR, like a nursing home. So that patient might not exist anywhere within HIE or within the Vynca system. So not only do we have to take and do matching from healthcare entities where the patient may have been to match up to that master patient ID, but we also have to match up, be able to enter that information into the Vynca system, and at the same time send that back to our integration, our HIE platform, so that we can match that up then for future references, so that we have that master patient ID, whether they come from a hospital, a clinic, a laboratory, or now even a location where they have completed a Vynca form that might not be any of the above. Our plan for the integration is after you query a patient in the Health Information Exchange, a query would go out to the Vynca platform and return the status of the yes or no for LaPost and advanced directives. Once that happens, if there is a yes there, you would click on that. And I think in Ryan's demo, he might show a little bit more of the EHR integration, but it would basically launch you into the dashboard for that patient to show their most current post or advanced care planning document. I did say advanced care planning, and one of the things that our current implementation is getting our POLST documents done. In the state of Louisiana, our other advanced care planning documents reside through legislature with the Secretary of State for all living wills, advanced directives, and medical power of attorneys. They all reside there. They are paper forms kept in a literal file cabinet that you have access to 8 to 5 Monday through Friday by calling a phone number, and they'll fax you that copy. Long term on our roadmap is to work with the Secretary of State to provide a total advanced care planning document registry for the state of Louisiana. More than likely it would probably still remain under the Secretary of State's office, with us just providing the electronic registry for that portion. So we've started initial conversations with that, but we're really looking at this being not just LaPost, but a complete, like I said, ACPD registry. And with that, I will turn it over to Ryan.
Great. Thank you, Alan, and thank you, Amy, for having us today. I'll first start off just by saying that much of the technology that's been developed was unfortunately inspired by many of the clinical scenarios that Alan had described around lack of availability of POLST forms, other forms of advanced care planning documentation, and seeing how that impacted care delivery at the end of life. So to see the Quality Forum take on LaPost as a priority and certainly to support the development of a registry really means a lot from a clinician's perspective, and we're very pleased to be partnering with you on that. I wanted to move to just explain a little bit about the registry experience, and I'm going to start by showing what the landing page or the patient's, what we call a dashboard, looks like. And the idea, as Alan alluded to, is that this is an aggregation of LaPost forms and eventually other forms of advanced care planning documentation in a single spot from across the care ecosystem. We've gone to the trouble of being very thoughtful about the clinical integration piece and what matters to particularly clinicians in an emergency situation. So we display in a structured format color-coded indicators of what the patient's preferences are. And the other major feature is that we are able to reconcile these forms by date. Obviously, in an emergency situation, very important to understand what the most current wishes are. So the system sorts those forms to display the most current one and automatically labels older forms as prior or incomplete if there is a new form being created. The other major aspect is that this is a tool to complete a digital and legally valid LaPost form. We know historically that 1 in 5 forms will have an error on it, missing signatures, missing dates, discordant choices, and I think many people are aware of those statistics. And having a digital completion tool that captures valid signatures helps to ensure that these forms are created in a legally valid way so that there's not a leak and issue with them being honored downstream. There's a lot of complexity to LaPost and to POLST in general in terms of how they're completed and how they're accessed, and the Vynca technology addresses these at several levels. The first is that we are able to define different roles within the system, whether administrative roles for uploading existing paper forms, preparer, as we call them, but these would be social workers or nurses, typically, who would be involved in the preparation and the conversation but unable to legally sign a form. And then signers, who are typically in the state of Louisiana, would be a physician. And then, of course, the patient as an important and critical stakeholder in having access to this data. The primary means of accessing the dashboard is web-based, and as Alan alluded to, there is a basic web portal access that providers can sign up for. But one of the real benefits of working with an HIE is the user access management. Because we're dealing with PHI here, very important to understand who is accessing that data and have a robust data privacy and security program that goes along with that. And being able to tie into an HIE really offloads a lot of that obligation of making sure that the right person is accessing the form at the right time for an appropriate reason. The last piece I'll highlight on this slide is the patient access piece, and there is the functionality for a patient to go in and view their document, to print out a copy for themselves, and also importantly to void the document should their wishes have changed. And we feel that ultimately this fits into a broader paradigm of high-quality advanced care planning, where a variety of frameworks and tools can be used to facilitate high-quality discussions between patients, family members, and clinicians. For those with a serious and life-limiting illness, this should be codified in a POLST form, and for others in other forms of advanced care planning documentation, and ultimately available across the care ecosystem, which of course is the primary function of the registry. One of the other ways that we can tie in to the clinician is through a direct EHR integration. And this is another great aspect about this particular collaboration, is that we have the ability to give broad-based access through the HIE. But for large health systems who may wish to have a more integrated and one-click access, we are able to do so. And this is a screenshot of a typical EHR where that POLST flag, or the LaPost flag, is embedded right next to other critical information, including allergies, etc. And the dynamic flag is something that we send in if we identify a form from another care setting, so that the user has a passive indicator that there's a document that they should be looking at. And when that's clicked, in one click it opens up that dashboard within the frame of the EHR, so it's a seamless experience for that clinician. And I wanted to end just with reporting. And reporting is really important for a variety of reasons. First and foremost, with a registry, we're always looking and curious as to what the outcomes are. And it's particularly important early on to be monitoring utilization, monitoring the number of forms being submitted, and if there are issues around adoption within a certain care setting, a certain region, it does give the opportunity to go back in and do more focused awareness and marketing efforts. It's really critical in hand with any technology for registry to have an equally robust marketing and awareness campaign, so that people know to go ahead and use it and access it, particularly for care settings outside of major health systems where the EHR integration is not potentially so obvious. So the first aspect of the reporting is really to drive adoption and to ensure that the registry is being successfully utilized. But there's a lot of other interesting drivers that we're seeing emerge, be they HEDIS measures or other quality metrics that are becoming requirements of ACOs, health plans, or otherwise. And advanced care planning documentation is increasingly being followed in those regards. we are increasingly being asked, particularly for the HEDIS reporting and the care of the older adult, for metrics around advanced care planning being offered or documents being completed, and those kinds of metrics that focus on the concept of advanced care planning being offered to patients. This can also then be mapped to care concordance and ultimately to quality programs around care concordance for care delivery at the end of life. So with that, I will pause and thank you again to Amy and to Alan. And Amy, I'll pass it back to you.
Great, thank you. This was a great presentation. If people have questions, they can type them into the chat box, which I think is lower left. Hopefully it's obvious. So we'll just give it a moment and questions can be put in there. The first question, speaking of reporting, has there been any measure by the state, health information exchange, or health systems regarding having an EHR integrated solution?
I will say from the quality forum standpoint, we are implementing this utilizing IAPD funds. And one of the milestones in our IAPD is EHR integration. But that's the only, I don't have any mandatory other than a milestone in our IAPD with the state of Louisiana.
I would say certainly the just to, in terms of the work that you've done, Amy, in terms of the national POLST paradigm and recommendations around technology, that work, which is certainly ongoing, I think will go a long way to defining that aspect of reporting and EHR integration specifically around that.
Great. Just give it another minute in case anyone else is writing in a question. Otherwise, if you do have questions that weren't answered, please feel free to email us at info@polst.org, and we will also be compiling questions to be answered in the white paper, which will be coming out of the conference that we're having. Information is on the POLST website. So we've got another question. Have there been any efforts made to get persons with a do not resuscitate order to become a POLST user? I can take a first stab at that and say we have a policy online that you can find. It's the appropriate use for a POLST form policy, and the final version, the final section of that, currently number 7, I believe, talks about the value of POLST as opposed to a do not resuscitate order, the fact that it goes beyond just saying do not resuscitate. For more information on that, I encourage you to watch the first webinar that I did with an overview of POLST, and I'm happy to have further discussion on that.
This is Alan. I believe on our POLST website we also have some information in our FAQ section for providers, and that's covering that.
We've certainly seen at an individual hospital level certain policies related to if there's an inpatient do not resuscitate order, developing policies and care pathways where that individual is offered a POLST form to be completed.
Next question, do I need POLST, both a POLST and an advanced directive? I can answer that. We encourage everybody to have an advance directive that talks generally about your treatment wishes, gives you the opportunity to identify the surrogate, the person that speaks for you if you become incapacitated, and everyone should have that once they turn 18 and then routinely update it. A POLST form is really only for people who are seriously ill or frail, whose healthcare professionals wouldn't be surprised if they died within a year. And when you do have a POLST form, we certainly encourage, and many of our states have language on the form reminding people to update their advance directive so that there isn't a conflict between the two documents. Additionally, in all but maybe 2 states, the surrogate identified in the advance directive has the ability to update the POLST form if the patient doesn't have capacity. So yes, we would encourage that. Any other questions, specifically about health information exchanges? These are a little bit more off the topic, but can I fill out a 5 wishes instead of advance directive? The answer to that is a 5 wishes form is an advance directive, but you would need to determine what state you are in as to whether or not it is valid. The last time I checked, which was this morning, but it was looking at 2016 information, 5 wishes was not being able to be used in 5 states. Let's see, Ohio, Indiana, Wisconsin, New Hampshire, and Texas, but you want to check on that. Next question. When does HIE anticipate going live with their electronic La Poste registry?
We're hoping to have phase 1 up. Our plan is to have it up early November with the web-based integration and the integration into HIE. As far as EHR integration, we are currently getting ready to really start working with some healthcare systems to do the EHR integration piece, and we don't have a projected date on that other than starting to meet with them this last 4th quarter to start planning on that with them. And I will say real quick, our initial push for it is we found through our paper-based forms, the majority of our paper-based forms come from nursing homes and palliative care. We had our La Poste Coalition meeting last week and got a lot of excitement from the state representatives for those associations to get it going back out there. It's kind of like anything with the HIE. You've got to have data out there for people to search. If they go out and they search 2 or 3 times and don't find anything, even though they know something should be there, they're going to quit using it. So we've got to get data populated into the registry so that whenever the EDs or some provider searches for it, that they do find data. Which EHRs? Ron, I'll let you take that one overall from what y'all are seeing nationwide as opposed to just Louisiana.
Yeah, it's a great question, and I think it really maps to market share on in each of the care segments. So certainly, Epic is probably the most, or is the most common integration that we do on the health system and acute care side. Cerner, of course, as well. And then on the ambulatory side, it's a little more variable, but certainly Allscripts, Athena Health, I would say, are the 2 large ones more on the ambulatory side. And then in the post-acute, there are a variety of different EHR vendors, including Point-Click Care. And I would say that there is a little more segmentation there. And as Alan alluded to earlier, there's a lot of variability in terms of the robustness of IT infrastructure at the post-acute level. So that leads to more potentially web portal access and otherwise being a solution there. There is also increasing question about directly integrating onto EMS systems as well. That's a common question that we get. But I would say that certainly the Epics and the Cerners are really where we see the most demand.
And just for the sake of the recording, the question was, which EHRs are you hearing the most demand for integration with? So thank you. Any other questions? Okay, well again, if you have other questions, please feel free to email me at info@polst.org. With the conference coming up, we want to make sure that we're addressing everything that is coming up from the states in our white paper, which will be coming out hopefully sometime early next year. For more information on the conference or the overall consensus project, which included these webinars, the conference, and the white paper, you can go to polst.org/tech-consensus. And certainly follow on our newsletter, which you can sign up at the bottom of our website, which is polst.org. So thank you very much, Ryan and Alan. We appreciate your time and presenting on the Health Information Exchange integration with the Law Post. And look forward to seeing those of you at the conference shortly.
Thank you. Look forward to being there.
Thank you.